Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. To do it to me. Here we are. Good morning.
Nothing like having fun.
Right. Did anyone see the moon last night?
Was it the full moon?
Oh, it was a special moon.
It was a special moon,
Oh,
yeah.
yes, it had like a little eclipse and it had some other things happening.
I didn't see it.
But it is a full moon.
At what time was it anyway?
I don't know. I just looked outside at about 8, 9 o'clock and it was full. I didn't see those other things, but...
Yeah.
But anyway, I was just, when Dr. Mencia came in, he's so slim and he's so trim, and I said, what do you do? Is this an exercise program that you have? And we thought we'd talk about exercise this morning.
Yeah. Oh, you have exercise and you have sexercise. Let's talk about exercise today.
Okay, but if you have exercise, it turns into sexercise, maybe.
Exactly. Well, exercise is a very important part, and it's a lot of time we come up with excuses. When I talk to my patient, do you exercise? And the number one excuse is, at work, I walk a lot. And I say, well, that's not really exercise. You know, other people, well, I have a big house, so I move all over the house cleaning up. That is no exercise. That is being active. You are being active, but you are not exercising. So exercise is when you put on the equipment to dedicate yourself the time to go for a walk, or the time to go on the treadmill, or the time to go on the pool. And you don't go on the pool, you know, a lot of us just go in the pool to refresh ourselves and enjoy the water and enjoy the scenery, but not to exercise. When you go in the pool to exercise, you start swimming nonstop for X number of miles or X number of minutes. And that's true exercise. So because you go in the pool and you move your arms around a little bit and you raise your arm and you raise your leg and you do nothing, then you drink a pina colada. You know, it is not exercising. You know, just with a pina colada, you have more calories than what you can burn for the next 2 or 3 hours. So exercise, you know, it's putting on the right equipment. And the number one thing, and you know, I'm a grandmaster in Taekwondo. You know, I spent my life teaching kids the sport of and the discipline of the martial arts. And when we exercise, we have to have on good sneakers. You know, and some people are going to listen to this show and or pick it up on the internet, on YouTube, and say, oh, that's a great idea. I'm motivated. Let me go out and exercise. Don't do it yet. Go and look at your sneakers. How old are they? And if they are old sneakers, go and get yourself some good sneakers. A lot of time we harm our feet. You know, I have one of my employees went to exercise with a wrong sneaker, and she came and said, oh, my God, doctor, look at these blisters I have. Huge blisters.
Yeah, but how do you know what's the right one? It's too late.
Something that fit comfortably. You know, your sneakers need to fit properly. If they are too tight, they are not for exercising. You can wear it to go out to a picnic or, you know, but not to exercise. You know, to exercise, you need good, comfortable sneakers. Your feet are extremely important. Your whole body weight land on your feet. And what happened when we disregard, let's put it that way, when we disregard our feet, then the back is going to suffer. That's why we have so many knee replacements, because we are penny wise, dollar full. Not to buy ourselves good sneakers, we use old sneakers. Say, you know, I'm not going to spend my money on that. You know, buy yourself some good sneakers. Now, there are two types of sneakers. They are fancy sneakers, and they are good sneakers. The good sneakers, they are not expensive. So a lot of people think if I pay, you know, you can spend $700 on a pair of sneakers.
Not I.
You know, because Oh, Michael Jackson wear this one, so it's $700. Or this baseball player or basketball player wear this kind, and that's his line. That's $700,000-$800,000. You can spend some money on sneakers. They have shiny with all the bling bling. No, that's not what we're talking about. We're talking about good, comfortable sneakers. And get yourself a pair of good sneakers. I have two pairs usually around. 2 pairs of sneakers, so I can alternate. Wear socks. When you exercise properly, you're going to sweat, and you want to keep your feet. Your feet is like your face. Some people treat their face, and they put the moisturizer, and they put the toner, and the cleanser, and the vitamin C, but you don't do anything for your feet.
That's true.
You don't put anything on your feet.
But it is important, you're saying, to wear socks?
Yes. Very important.
So then when you buy sneakers, you have to buy them a little bit larger so the socks
exactly
can go on too.
So when you go and try on your new sneakers at the store, you bring your socks. Put your socks on, and then put your sneakers on.
Well, you've just helped me because I will go buy new sneakers. My sneakers, I hate to tell you this probably, I'm embarrassed to tell you, they're so good, but they're like 6 years old.
Now, a lot of people, then you have to see what are your medical situation, what are your problems. If you have no knee problem, no hip problem, no back problem, you can choose between swimming or jogging or what have you. You can choose. If you have knee issues or back issues, if you're going to don't do the bicycle that stands up. You want to do the recline bicycle. So when you do the recline bicycle, what you are doing is taking your knee now horizontally moving up. And when you are pedaling on the recline bicycle, you're taking all the weight off your knee. On the stand-up bicycle, all the weight by gravity is coming on your knee. And when you are cycling, those knees are bending and coming almost straight. So you can do a lot more damage to your knee if they're already damaged. But
wouldn't swimming be better if you have a problem with your knees? Or
swimming, there's another division on exercise. There's one that's called weight-bearing exercises and non-weight-bearing exercise. Weight-bearing exercise are very important for your bones. The non-weight-bearing exercise is a good cardiovascular for your heart. So I like both of them. I like the swimming. I go in my pool. I go swimming. And then I don't like the running, but I like the walking. I like to go for a walk, And some people, they do very well walking by themselves. They are very happy to do that. When you walk, it's no window shopping. It's walking. So when you do walk, concentrate, put your body into walking, your posture, your breathing. So when I walk, I take a few steps and inhale, then take another few steps and exhale. And I concentrate on my breathing when I start walking. Before I start doing meditation and other thing, I just concentrate. So I go 1, 2, 3, 1, 2, 3.
Really?
1, 2, 3. Yeah, because in exercise, you have aerobic and anaerobic. Aerobic is air. So if you breathe, you are doing aerobic exercise. Aerobic is very important for your heart. So you're doing aerobic. When you do anaerobic, that you forget to breathe and you start walking and your breathing is not apart with the level of exercise, you're gonna build up carbon dioxide. And carbon dioxide, when it builds up in the muscle, it's gonna be painful. So then you stop exercising because you say, oh, this is not for me. I'm in too much pain. You are in too much pain because you are not breathing properly.
I have to tell you, if you just listen to this is not an exercise coach. This is an MD. This is Dr. Andy Mencia, who does everything. But I just want to make that very clear. We're talking about exercise.
Until we get to the exercise part. This is going to get good.
Well, the important thing is that Dr. Mencia actually he really loves his patients, and he isn't the kind of doctor who just loads you with pills. He'll say to someone, you need to exercise or you need to go on a diet, and we don't get that from a lot of doctors. But Dr. Mencia can be reached by going to his Saturdays. You can go to his Commercial Boulevard practice. It's a big center there. He has lots and lots of highly trained specialists. But let me just give you a phone number, 954-489-1345. And if you want to go to Boynton Beach, it's 561-270-6494, because there is one over there on Hagen Ranch Road. And
the spa.
I don't want to forget the Stonewater Med Spa.
Med Spa.
Maybe you ought to have exercise classes there. That could be interesting, isn't it? You could
I have to expand the room.
You could be expand the room. But Stonewater Med Spa is fabulous. It's on East Oakland Park Boulevard, Fort Lauderdale, and Dr. Mencia is the medical director there. Go online to stonewaterfla.com. I need to get that in there because you're on a roll, and I know if I don't, we'll never get that in. So keep going with this exercise, please.
So let's this is pencil talk. Let's not forget that.
Write it down.
Sometimes we forget.
Write
Dr. Mencia and Anita, they talk so much.
Write it down.
If you didn't write the phone number, then you won't get this. So this is pencil talk. Write this down. You can research this. Let's say people going for a walk. Non-stop, devoted to walking, concentrated, doing what I just said, breathing properly, watching your posture, all of those things. If you do this for 4 miles a day has 7 days, right? 7 days, a week has 7 days, right? So 7 days in a week. So we're going to take only 4 of those 7 days. So 4 miles, 4 days out of the week. You are going to you're going to lose without changing your diet. This is nothing to do with your diet. Now, a lot of us, when we want to lose weight, we change our diet and we exercise. And then you're going to lose a lot more. But this is the data that we have. And as a grandmaster, these are the information that we utilize when we are training and we are coaching people to go to world championship. So if you do 4 miles a day, 4 times a week, you're going to lose about half a pound a week of fat. Okay, fat that you store in your body that you don't need. You're going to lose about half a pound per week. If you do that now, if you keep doing the calculation and you do that for 6 months, that is 12 pounds of fat that you will lose. And if you do it for a year, if you do it for a whole year, you will lose 24 pounds in a year, only by walking 4 miles 4 times a week.
So I have a question. Can you walk 2 miles in that same day and 2 miles, or has to be 4 miles all at one time?
No, it can be 2 and 2.
It can be 2 and 2.
It can be 2 and 2. You can break it down into 5 days instead of 4 days. You can do, 6 days. You can do whatever you want to. You can, as long as you're doing, those 4 miles, that 16 miles that you're doing a week, you can break those 16 miles any way you want to.
Okay, but let's also...
I like to exercise first thing in the morning, do some exercises, do some meditation. Then I like to exercise also in the evening because I'm too busy to
so
put
you
a
can
whole...
break it up.
I need to break it up because, I'm still the first one to show up to work, especially when my manager has her son. She cannot come in early, so I have to be there to make sure everything is ready, running. You'll be amazed. Sometimes you go in, the computer shut down. So I'll be calling call the IT guy, the computer shut down. By the time the patient come in, I want to make sure everything is up and running.
I know, you are very, very good at that. But I want to ask you about this.
And the front desk, I call that my tower control.
It is tower.
I say, you guys are tower control.
It's
you
true.
are here to see plane landing, plane taking off, plane up in the air.
It is.
Who you have out there waiting. You have to look at the parking lot. You have to make sure everybody's here. You have who's sitting there that has not been attended to. That's my tower control.
And you have a young man there who is spectacular.
Oh, yeah, George.
He really is, I think, at least for me, when I go there, he's like the best person because he makes sure everything there.
I promoted him. He's not there no more. He's now
No, that's
the
not good.
operator.
That's
no,
not
but he's
good.
still great. He's still great, but he's doing like the phone, and he's so dynamic. You'd
I
be
know, but
amazed.
that person in the front, he was wonderful.
No, but he is wonderful. But so I like to see my people move up into management position.
So who are you going to get as good as he is?
This young lady right here.
Oh, I know about her.
Ina started in the front,
Right.
and then she went to scheduling, then she went to checkout, then she went to operator. And I say, keep doing what you are doing. You will become a manager.
No, she is. It was
And
obvious.
Georgie, he's following the same step. He's
But
following. He will be
okay.
He's going to be a great manager. He's well educated, like Ina. Ina is an engineer. He just got his diploma. I have to write a letter of recommendation, and his was it Finland? That's
Yes.
it. Yeah, Finland sent him his diploma for college. So
No, he's
he
really
graduated.
wonderful. I'm
Very
glad that
smart
you're
guy,
doing that. Yeah.
And I I always tell my staff, I can bring managers from the outside to run the company. We're highly qualified, but it's nothing that I love more to see my people move up from within.
Yeah,
So I
you've
always
done a
do
great
that.
job with that. But I wanted to go back to the exercise for a minute. But there's one thing that you didn't say, and I think it helps. When you have a lot of, especially for me now, just getting over the death of my husband, when I walk and I'm outside, not in a gym, it changes my whole outlook about
Right.
things. I'm not feeling as sad. And so there's another part about walking, isn't there?
Well, exactly. You start releasing these chemicals that will wake you up, give you energy. Some people will go, like in your case, and say, "Let me go and take an antidepressant for a few months." You don't.
I'm
you
not.
don't-
I'm not.
No. Many people in your case will do that. Say, "Let me go for an antidepressant for a few months." It's like when Bill, may his soul rest in peace, you and I sat in a room.
He's not resting in peace. He's on a new adventure.
He's in a new adventure. So, when he came with his shortness of breath, and we say, you are full, you know what, and we got him the broom, and so it's natural, right? It's a natural way of treating medical problems. So, a natural way of treating depression and anxiety is through exercise, because you release all this chemical that, because those chemicals belong to you, they will go into your brain. There is a what we call the blood-brain barrier, and what the blood-brain barrier does is things that you take, pills that you take, if they are certain size in particles, they will go around your body, but they cannot cross that barrier, so they won't touch your brain. But there are others that are small enough that will go into your brain, and some of them, you get the patient saying, "Oh, doctor, I took this pill and my mother went crazy. I never seen her like that. She was cursing, throwing things, and we stopped the pill and she came back to normal." That means that medication is able to cross into the blood-brain barrier. And there are many other medications that we take that don't even touch that. So when we exercise, these are natural chemicals that we produce. So all of them can go into the blood-brain barrier. And all of them can go there and treat anxiety, and treat depression, and help with Parkinson, and help us with dementia. All of those chemicals that we release. There's one chemical that we release that is a painkiller. So when you exercise, people that exercise, when you question them compared to people that are sedentary, they are in less pain. The sedentary people are in more pain than the people that exercise, because they are not releasing any of those chemicals. And because they are in more pain, it becomes a vicious cycle. So you exercise less, and then obesity comes to be, and what have you. So exercise is very important because of that. When you release all those chemicals, it's able to cleanse the artery in your heart. It's able to help you with your lung, to maintain your lung properly. Everything that we do is a give and take. You can exercise, walk the 4 mile that we just discussed, and then stop by McDonald's and have a double cheeseburger and French fry. And then, instead of losing half a pound, you're probably going to gain the exercise will give you the half a pound, but the the double cheeseburger is going to give you a pound. So you gain half a pound. Instead of lose, you can either do no exercise and do the double cheeseburger, that's 1 pound, or do the exercise and the double cheeseburger, you gain half a pound. But you're still gaining. It's not helping you.
Right, but we were also talking about people who go to these delis and they have these sandwiches of corned beef, this huge sandwich.
Right.
And, you know, that's not only does it have a lot of salt, but it has a lot of fat, even if it's lean. And so why can't people just take a cup, just for the taste of it, take a couple of slices, put it on the bread, and be satisfied with that?
And I'd say, you know, like Doug was saying, what I do if I just take the meat out, put the bread on the side, and I might have a bite or two of the bread and eat mainly the meat and then choose with them the meat. And I tell you, I'm so sensitive to salt. If I feel that it's salty, I stop. But, you know, and I've seen so many patients going into the emergency room with congestive heart failure because they went and ate canned ham, which is loaded with salt, you know, or any of those products out there that you know they are loaded with salt and you are not used to it and you do it, you know, one time you go out with friends and they say, this is what we're going to eat, and you go crazy and you cannot stop eating. You know, you can end up with congestive heart failure. Those, you know, a lot of those patients don't go to that extreme, but they come and they say, you know, I'm getting swollen ankle now. Where do you think that's from? And the first thing I say, I look at the vein, like Dr. Mai was saying. We look at the vein to see maybe you have venous insufficiency. But then I look at the diet. You know, how much salt? Do you use a salt shaker? That's my go-to question. You have a salt shaker. I don't have a salt shaker.
I don't either.
You know, I don't use a salt shaker.
But there's so much natural salt in food, even if you don't believe it. I mean, you look at certain foods and there's all that salt in there. So you can't add salt.
Well, you know, imagine, and salt is a selling point for restaurant. That's a big selling point. And
why?
If you want to, why? Because it tastes better.
Salt I see what you're saying.
Salt and fat.
Oh, they salt
a lot of
themselves.
salt and a lot of fat, and people will eat the whole plate.
And then they drink.
Yeah. And then you order more drinks because the salt make you thirsty. Bring the drinks.
So the salt is what they're right.
So if you want to do a test, this is for everybody out there. If you're gonna go out to eat, do this test. You weigh yourself. You know, weigh yourself before you get yourself naked first. Weigh yourself before you get dressed to go out. Then go out and eat like you normally would. Just go out and eat like you normally would. And then when you come, weigh yourself again and see how many pounds you gain.
Well, Chinese
At
food
least
does
2
this.
to 4 pounds.
Chinese food does this.
Food, yeah, and you want to eat more. And the good thing with Chinese food is that the salt, because it's liquefied, you eat and then you feel like after half an hour, like, oh, I'm ready to eat again. And you go and get some more.
Well, this has been a great show. I mean, I need to tell you again about Dr. Mencia. No, poor Dr. Mencia. No, I want everyone to know that Dr. Mencia really, this is how he practices medicine. He really does a wonderful job of telling everybody.
And you know how many patients, I have a diabetic specialist that we're going to bring to the show. You know, I'm dying to bring him to the show. I'm not dying, but I'm anxious to educate with regard to diabetes. But you don't know how many pre-diabetic I have cured by just having the dietitian, and I give them an exercise regimen.
I want to tell you that's funny because I knew someone who was a diabetic, and he walked a lot for a year, and he's off the medication.
Yeah.
I'm just thinking about what you said.
Yeah, a lot of my patients, they come in for the first time, oh, I'm taking metformin, or I'm taking this. I say, okay, do you want to get off the pill? Can I? They told me I can never get off this pill. I say, it's up to you. If you want to live your lifestyle, no, you will never get off that pill. But if you want to change your lifestyle, we can get off the pill. We can attempt at least, let's give it a shot. And they get motivated, and a bunch of them get off this pill.
You have motivated me so much, and you too, Ebony. We are motivated now to start our exercise regime. Yeah,
I'm going to start running now to the office, from here
sneakers.
to the office.
There you go. You'll be running, I'll be driving the car, and you'll be running.
Yes. Wait for me.
Well, this has been wonderful, and I'd always thank you. You you do create such a motivation for everybody. And
There's
remember, they're open on Saturdays. Excuse me, I keep putting you on Sundays now.
They're open on Saturdays.
Saturdays.
Sunday. We're going to send Anita there on Sundays. too.
Right, Saturdays. And also remember, they do have home visit services available in Dade, Broward, and Palm Beach County. Really important. Don't forget, homebound patients really need care. And thank you, Dr. Mencia, for doing that. And we are going to see you here next Saturday, maybe before. If you want to
so
pick
who's
up...
coming next? Who's coming next?
Joe Carp.
Joe Carp.
And he always listens to you.
And I like that picture of him in Boomtown.
Oh, yeah.
What page was that? For people listen to him. They listen to us, and they don't even know what we look like.
That's true.
They don't know. I like that page.
It's now on page 28, right across from Bill Finley's On a New Adventure, but it's Who Are We? And you'll see Joe Carp.
Yeah, the handsome guy there.
Joe Carp and you, Andy Mencia. It's really Who Are We? It tells us all about us. It's our February issue, and you want a copy, you can go down to Dr. Mencia's and pick up a magazine.
And Bill
right?
is in the front cover.
Yes, he is.
You
on the
people
front
that ask
cover.
about Bill.
Yeah,
and when
he is
Bill
there.
was sick, you were asking me,
Yeah.
how's Anita? How's Bill doing? His picture is in the front cover.
It is. So life goes on, doesn't it? But
yes.
You're very inspirational. And, of course, Ina's been sitting here looking beautiful. And, she really runs a lot of the enterprises that Dr. Mencia has, especially the Med Spa, which is, very, very important. So
Ina doesn't talk until the show go off. Then she's a parakeet.
And then I can stop.
Okay, so you can just say goodbye to everybody so we make
Goodbye.
До свидания.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.